My name is Dr. Christopher Cook, and I am an orthopedic spine surgeon at Graves Gilbert Clinic. So my focus in the patients that I typically see, patients that are having low back problems, mostly adult patients with degenerative issues, with osteoarthritis or osteoporosis, and then that translates into, as we age, spinal stenosis and the kind of cascade of symptoms that happen with that degenerative process. Besides low back problems, also deal with the cervical spine and issues with the cervical spine, mainly neurological symptoms, whether it's weakness or outstanding pain. There are some patients that we see that have some deformity on top of degeneration of their spine, which can kind of be a double issue, and it's important to recognize that, and that was a focus of my training in orthopedic spine surgery. There's a significant percentage of patients that have low back pain or any type of back or neck pain at some point in their life. Whether or not they need surgery, of course, is determination of both primary care physicians as well as myself. And the patients will come to see me to ask their opinion because they obviously aren't sure whether this is something that can be treated surgically. And of course, we still stress, myself and everyone at Graves Gilbert, conservative care first. And that type of mentality was something that really drove me to come to this practice as well. But that's typically what we start off with every patient's conservative care. And once those have been exhausted, then maybe we'll consider what type of treatment options there are. And then once they are informed, we kind of make a decision together whether this is something we want to go forward with. When it gets to that point where they've exhausted these and I've created a relationship with that patient, then we go ahead and talk about the operative interventions that I can offer. And I make sure that I go through all the details of the surgery with them so they know exactly what is going to be done and what benefit they're going to get realistically from that operation. What a patient can expect from their recovery can differ. Some patients can expect to be back at work in a couple of weeks from simple decompressive surgery. But for fusion, sometimes it can take a little longer, and I like to work with patients to see how they're doing in that post-op period before allow them to get back to work. And of course, it also depends on what type of work they're doing, whether it's manual labor or work in an office setting. I put my heart into every patient that I see in the office, and I create that relationship because there has to be a degree of trust on both sides, and creating that trust and focusing on that is very important to me, and I feel that that's a strength that I have, that I'll take that trust and always keep that with them, with myself. I came to Bowling Green because ultimately I wanted to settle in a community, in a nice community where I can take care of patients in a setting where it's the same setting where I'm going to be living in. In a small community type setting like Bowling Green was kind of the perfect fit for myself and my family. And to see people on the street that I'm going to be taking care of is something that's important to me.